In this video, I am going to discuss about the facial nerve. Facial nerve is a mixed nerve. It consists of motor fibers and the sensory fibers. There are two types of motor fibers. First is branchiometer fibers or spatial visceral efferent fibers. These fibers supply the muscles of face, which is derived from the second branchial arch. Thus, these fibers are responsible for the different facial expression. Second type of motor fibers is secretometer fibers or general visceral efferent fibers. These fibers gives the parasympathetic innervations to the lacrimal gland, submandibular gland and sublingual salivary glands. Thus, these fibers induce the lacrimal gland for the secretion of tears and submandibular and sublingual salivary glands for the secretion of saliva. Similar to the motor fibers, there are two types of sensory fibers. First is spatial visceral efferent fibers or taste fibers. These fibers bring the taste sensation from the anterior two-thirds of the tongue and the soft palate. Second type of sensory fibers is general somatic efferent fibers, which bring the cutaneous sensation from the concha of auricles. Now, we discuss these fibers one by one in detail. Before start the discussion about these fibers, I want to explain this schematic diagram. In this diagram, here is a bony orbit. In the roof of bony orbit, lacrimal gland is present. Below the bony orbit, maxilla should be present, and below the maxilla, tongue is present. Above the bony orbit, anterior cranial fossa is present. Here is the medial cranial fossa, and behind to this line is the posterior cranial fossa. In the posterior cranial fossa, brainstem is present, which includes midbrain, pons, and medulla. This is the cerebellum, and here is the fourth ventricle of the brain. Behind the maxilla and below the posterior part of the bony orbit, pterygopalatine fossa is present. This is the medial wall of the middle ear. This is the posterior wall of the middle ear. This is the floor, and this is the anterior wall of the middle ear. Here is the opening known as the internal acoustic meatus. Through this opening, a canal is present in the petrous part of temporal bone. This canal is known as facial canal. This canal has three parts. This is the labyrinthine part of the facial canal, which lie within the petrous part of temporal bone. This is the tympanic part of facial canal, which runs horizontally along the medial wall of the middle ear. And last is the mastoid part of the facial canal, which runs vertically along the posterior wall of the middle ear. Near the anterior superior part of the medial wall of the middle ear, geniculate ganglion is present. First, I am going to discuss the Branchiometer fibers or spatial visceral efferent fibers. Motor nucleus of the facial nerve is found in the lower part of the pons. From this nucleus, the branchiometer fibers arises, and instead of moving forward, first they runs dorsally towards the abducens nucleus. Here they loop around the abducens nucleus and then move ventrally. In the ventral aspect of brainstem at the pontomedullary junction, this fiber exit the CNS as motor route of facial nerve. An elevation is created in the floor of fourth ventricle due to looping of these fibers, and this elevation is known as facial colliculus. Sharp turn of these fibers within the CNS is known as internal genu. Now, this fibers passes through the internal acoustic meatus and run within the labyrinthine part of facial canal. Near the medial wall of the middle ear, this fibers passes through the geniculate ganglion, and without relay here, they enter into the tympanic part of facial canal. Sharp turn of these fibers within the geniculate ganglion is known as external genu. From the tympanic part of facial canal, they enter into the mastoid part of facial canal, and within the mastoid part of facial canal, they gives a branch known as nerve to stapedius, which supply the stapedius muscle. After giving this branch, this motor fibers runs downward and leave the cranium through the stylomastoid foramen. Now, I am talking about the external cranial course of these fibers. Below the stylomastoid foramen, motor fibers gives three branches. First is posterior auricular nerve, which supply the occipital belly of the occipitofrontalis muscle. Second is nerve to posterior belly of digastric, and last is nerve to stylohyoid muscles. After giving these branches, these fibers moves forward and loop around the lateral aspect of root of styloid process. Then they enter the posterior medial surface of parotid gland and divide into the 5 terminal branches, that is temporal, zygomatic, buccal, marginal mandibular and cervical. Through these 5 terminal branches, these fibers supply the entire muscles of the face and produce different facial expressions. Now, I am going to talk about the secretomotor fibers or general visceral efferent fibers. The pre-ganglionic parasympathetic secretometrofibers are arises from the superior salivary nucleus and passes through the internal acoustic meatus and then run within the labyrinthine part of the facial canal. Then these fibers passes through the geniculate ganglion and without relay here some of them enter into the tympanic part of the facial canal and some of them moves upward and enter into the middle cranial fossa through a hiatus. In the middle cranial fossa, these fibers move forward and enter into the foramen lacerum. Instead of exit from the bottom of the foramen lacerum, these fibers enter into the opening at the anterior wall of the foramen lacerum and passes through the pterygoid canal. Then these fibers enter into the pterygopalatine ganglion located in the pterygopalatine fossa and relay in this ganglion. Now the post-ganglionic parasympathetic secretomotor fibers are arises. To reach their final destination, that is lacrimal gland, these post-ganglionic secretomotor fibers takes a lot of jump. For the better understanding of these jumps, let me discuss about the large sensory ganglion, that is trigeminal ganglion. It has 3 branches: ophthalmic branch, maxillary branch and mandibular branch. Ophthalmic branch enter the bony orbit through the superior orbital fissure. In the orbit, it divides into frontal, nasociliary and lacrimal branch. This lacrimal branch supplies the lacrimal gland. Maxillary nerve passes through the foramen rotundum and enters into the pterygopalatine fossa. One of the branch of maxillary nerve, that is zygomatic nerve, enter the bony orbit through the inferior orbital fissure. In the lateral wall of bony orbit, this nerve divides into zygomatico-temporal nerve and zygomatico-facial nerve. Now, these postganglionic secretomotor fibers run along with zygomatic nerve and enter into the bony orbit through inferior orbital fissure. Then it runs along with zygomatico-temporal nerve and then it takes a final jump and runs along with the lacrimal nerve to innervate the lacrimal gland and induce the lacrimal gland to secrete tears. Now, I want to discuss the pre-ganglionic secretomotor fibers which enter into the tympanic part of the facial canal. From the tympanic part of the facial canal, they enter into the mastoid part of the facial canal. Now, these fibers leave the facial canal through the posterior canaliculus in the posterior wall of the middle ear and enter into the middle ear cavity or tympanic cavity. Then these fibers run across the lateral wall of the middle ear and leave the tympanic cavity by passing through the anterior canaliculus in the anterior wall of the middle ear and emerges at the base of skull through patrotympanic fissure. To know the future of these fibers, let me discuss about the mandibular nerve. Mandibular nerve leaves the cranial cavity by passing through foramen ovale. After passing through foramen ovale, it divides into a small anterior division, posterior division. One of the branches from posterior division is known as lingual nerve, which innervates the anterior 2/3 of the tongue and floor of the mouth and brings the general sensation like touch, pain and temperature from the anterior 2/3 of the tongue. After emerging from the base of the skull, these pre-ganglionic secretomotor fibers runs forward and join the company of lingual nerve. But instead of going towards the tongue, they leave the company of lingual nerve and enter into the submandibular ganglion and relay here. The postganglionic parasympathetic secretomotor fibers arise from this ganglion and innervates the sublingual and submandibular salivary glands and induce these glands to secrete saliva. Now I am going to discuss the spatial visceral afferent fibers or taste fibers. Taste fibers, which bring the taste sensation from the soft palate, first passes through the pterygopalatine ganglion, and without relay here, they enter into the foramen lacerum through the pterygoid canal. From the foramen lacerum, these fibers enter into the middle cranial fossa. Then these fibers runs backward and leave the middle cranial fossa through the hiatus and enter into the geniculate ganglion and relay here. Here I explain some interesting points related with these pre-ganglionic secretomotor fibers related to the lacrimal gland and taste fibers related with the soft palate. Both these fibers are together known as greater petrosal nerve, which extend from the geniculate ganglion to the anterior wall of foramen lacerum. Internal carotid artery enter into the carotid canal and passes through the foramen lacerum to enter into the cranium. Some fibers from the sympathetic flexes around the internal carotid artery moves forward within the foramen lacerum. These fibers are known as deep petrosal nerve. In the pterygoid canal, greater petrosal nerve and deep petrosal nerve are comes together and collectively known as nerve to pterygoid canal or Vedian nerve. This means nerve to pterygoid canal consists of three fibers. First is pre-ganglionic secretometer fibers, which gives parasympathetic innervations to the lacrimal gland. Second is taste fibers, which bring taste sensation from the soft palate. And last are post-ganglionic sympathetic fibers, which give sympathetic innervations to the lacrimal gland. Now I discuss about the taste sensation from the tongue. Spatial visceral afferent fibers, which bring the taste sensation from anterior two-thirds of the tongue, first run along with lingual nerve. Then these fibers leave the company of lingual nerve and run side by side of Secretometrofibers related to the submandibular ganglion. Along with these Secretometrofibers, taste fibers also enter into the tympanic cavity. Then they cross the tympanic cavity and enter into the mastoid part of the facial canal through posterior canaliculus. Now these fibers moves upward and passes through the tympanic part of facial canal and enter into the geniculate ganglion and relay here. Here, these taste fibers and secretomotor fibers together known as chorda tympani nerve, which extend from posterior canaliculus to their final destination to the anterior two-thirds of the tongue and submandibular ganglion. As we can see, this nerve passes through the tympanic cavity. That's why it is named chorda tympani, which means a chord within the tympanum or middle ear. Now, the post-ganglionic spatial visceral afferent fibers or taste fibers arise from the geniculate ganglion, which travels through the labyrinthine part of the facial canal and passes through internal acoustic meatus. Finally, these spatial visceral afferent fibers terminate into the nucleus tractus solitarius. From this picture, it is clear that apart from the motor branches of facial nerve, chorda tympani nerve and greater petrosal nerve, both are the spatial branch of facial nerve which carries general visceral efferent fibers and spatial visceral afferent fibers. The last fiber related to the facial nerve is general somatic afferent fibers. These fibers bring the cutaneous sensation from the concha of auricle. First, these fibers run along with the auricular branch of vagus nerve and enter into the mastoid part of facial canal. Then, these fibers passes through the tympanic part of facial canal and reach the geniculate ganglion and relay here. From the geniculate ganglion, post-ganglionic general somatic afferent fibers arises, which travel through the labyrinthine part of the facial canal and passes through the internal acoustic meatus. And finally, these fibers terminate into the spinal nucleus of trigeminal nerve. General visceral efferent fibers, spatial visceral afferent fibers and general somatic afferent fibers, collectively known as nervus intermedius or nerve of Risberg or glossopalatine nerve, which is the sensory component of the facial nerve. So it is clear that spatial visceral efferent fibers or Branchiometer fibers present as motor root at the pontomedullary junction and forms the facial nerve proper, while the rest of the fibers of the facial nerve forms nervus intermedius and present as sensory root at the pontomedullary junction. The sensory root of facial nerve lie between the motor root medially and vestibulocochlear nerve laterally. That's why it is named nervus intermedius, which means intermediate nerve. Now, I want to summarize the topic. Facial nerve consists of four fibers. First is spatial visceral efferent fibers or branchiometer fibers, which arise from the motor nucleus in the pons. Then, these fibers enter into the labyrinthine part of the facial canal through internal acoustic meatus. Then, these fibers passes through the geniculate ganglion, and without relay here, they traverse through the tympanic part of the facial canal and enter into the mastoid part of the facial canal. Here, these fibers give a branch known as nerve to stapedius. Then these fibers leave the cranium by passing through stylomastoid foramen. Below this foramen, these fibers give posterior auricular nerve to posterior belly of digastric muscle, and nerve to stylohyoid muscle. After given these branches, these fibers moves towards the face and divides into five terminal branches, that is temporal, zygomatic, buccal, marginal mandibular, and cervical. Through these five terminal branches, these fibers supply the entire muscles of face. Second fibers related to the facial nerve is general visceral efferent fibers or Secretometrofibers. These fibers are arises from the superior salivary nucleus. After that, these fibers participate in the formation of nervus intermedius. Then these fibers passes through the geniculate ganglion, and without relay here, few of these fibers moves upward as greater petrosal nerve, which enter into the middle cranial fossa. Then greater petrosal nerve passes through the foramen lacerum and enter into the pterygoid canal. Within the pterygoid canal, greater petrosal nerve joined with the deep petrosal nerve and forms nerve to pterygoid canal or Vidian nerve. Then these fibers passes through the pterygopalatine ganglion and relay here. Now the post-ganglionic secretomotor fibers are arises, which first run along with the zygomatic nerve, then zygomaticotemporal nerve, and then along with the lacrimal nerve to innervate the lacrimal gland. Some secretometer fibers from the geniculate ganglion passes through the tympanic part of the facial canal and enter into the mastoid part of the facial canal. From the mastoid part of the facial canal, these fibers leave the facial canal through the posterior canaliculus and participate in the formation of chorda tympani nerve. This chorda tympani nerve runs across the tympanic cavity and emerges at the base of the skull through patrotympanic fissure, then join the company of the lingual nerve. After the short course with lingual nerve, secretometer fibers of the chorda tympani nerve leave the company of lingual nerve and enter into the submandibular ganglion and relay here. The postganglionic parasympathetic secretometer fibers arises from this ganglion and innervate the sublingual and submandibular salivary glands. Third fiber related to the facial nerve is spatial visceral afferent fibers or taste fibers. Taste fibers, which bring the taste sensation from the anterior two-thirds of the tongue, first run along with the lingual nerve. Then these fibers leave the company of the lingual nerve and run side by side of secretomotor fibers related to the submandibular ganglion. Here, these taste fibers and secretomotor fibers together form chorda tympani nerve. Through the chorda tympani nerve, these fibers crosses the tympanic cavity and enter into the mastoid part of the facial canal through posterior canaliculus. Now, these fibers passes through the tympanic part of the facial canal and enter into the geniculate ganglion and relay here. Taste fibers, which bring the taste sensation from the soft palate, first passes through the pterygopalatine ganglion, and without relay here, they enter into the pterygoid canal and participate in the formation of Vidian nerve or nerve to pterygoid canal. From the pterygoid canal, they enter into the foramen lacerum and takes part in the formation of greater petrosal nerve. Then these fibers enter into the geniculate ganglion and relay here. The postganglionic spatial visceral afferent fibers arises from the geniculate ganglion and participate in the formation of nervus intermedius. Finally, these fibers terminate into the nucleus tractus solitarius. So, apart from motor branches of facial nerve, chorda tympani nerve and greater petrosal nerve, both are the spatial branch of facial nerve which carries general visceral efferent fibers and spatial visceral afferent fibers. The last fibers related to the facial nerve is general somatic afferent fibers. These fibers bring the cutaneous sensation from the concha of auricle. First, these fibers run along with the auricular branch of vagus nerve and enter into the mastoid part of the facial canal. Then these fibers passes through the tympanic part of the facial canal and reach the geniculate ganglion and relay here. The post-ganglionic general somatic afferent fibers arises from the geniculate ganglion and participate in the formation of nervous intermediates. Finally, these fibers terminate into spinal nucleus of trigeminal nerve.